Hi, this is Erma Grego from Senior Perspective. Today I would like to introduce Tony Zuloaga of Keystone Rehabilitation Systems and the Center of Wellness of McMurray. They're located at 155 Waterdam Plaza, and the purpose of the place is to benefit and service the Peters Township and surrounding communities, and it's been since 1992. So, Tony, you don't mind if I call you Tony?
No, everybody calls me Tony.
Okay. What is the Keystone Systems
Rehabilitation
Systems, yes.
Keystone Rehabilitation Systems is a freestanding physical therapy clinic that specializes in orthopedic and sports rehabilitation for all ages. We see from babies to senior citizens.
Mm-hmm. So I've seen some coming in here that, and going out is a different story. I mean, they walk much better when they go out.
That is right.
What is physical therapy, and who would benefit from it?
Physical therapy is a healthcare profession that specializes in the rehabilitation of medical problems or health-related conditions that affect the ability of an individual to perform their daily activities. So that may be due to pain, due to a weakness or lack of mobility, balance problems, difficulty walking, all those conditions. Then a physical therapist can assess and determine the cause and then treat them to bring the patient back to their normal activities. Mm-hmm. There is right now a move within the physical therapy profession towards specialization. So there are various specialties in physical therapy, including orthopedics. There's also geriatrics specializing in the senior population, pediatrics specializing in children, neurological physical therapy for people with strokes or other neurological problems, and others. I'm a certified specialist in orthopedics, and I have been a specialist since 1992, actually. So I have been practicing for over 25 years now, again specializing in orthopedic and sports-related conditions. And that means patients or people that have had strains or sprains in their muscles or joints, people that have had surgery, let's say a total knee replacement or a total hip replacement, or knee surgery for ACL problem, or a shoulder surgery for rotator cuff or other problems, foot and ankle surgery, people that have had fractures and they have been immobilized with a cast or with a brace, and once the cast or the brace are removed, they find themselves with weakness or stiffness, lack of motion. All those conditions then are treated by physical therapists. People that have balance problems, people that have difficulty with their coordination for walking due to a myriad of problems, conditions that can cause difficulty with, again, balance or walking. People that have frequent falls. All those patients, people can benefit from seeing and being assessed by a physical therapist. Patients that have headaches. Some headaches are related to neck, cervical problems. And that's something that we are also very successful with in treating those conditions. Patients that have fibromyalgia or myofascial pain syndrome, and back and neck conditions. Okay. We see numerous patients coming here who have had sometimes back and neck problems for many years. And they have had different tests and different procedures. The tests, x-rays or MRIs and so forth, have not shown much, but they continue to have these problems. And we see that in active people, people that want to do their yard activities, people that want to do their household activities, or even their work activities sometimes. We see people that do sports, runners, cyclists, and golfers, who have what is called mechanical problems that lead to imbalances in their joints, in their muscles, and in turn they lead to more pain and dysfunction, and they find themselves unable to perform their daily activities or their sports activities. All those people, all those patients then can benefit from seeing a physical therapist. We are highly trained in being able to assess the condition and tailor a treatment program to their specific condition, their specific problem. And the keys to doing that is, first of all, a thorough assessment of the patient. So whoever comes here for physical therapy, we allocate at least an hour just to assess the problem and determine what are the causes of that problem, what are the symptoms, what are the findings, and then we can then treat and correct the problem, the cause of the problem, and not just the symptom. And then we give also the patient the tools to be able to maintain that correction, so they can hopefully prevent later reoccurrences of the condition. So we give some education to those patients in terms of body mechanics. We also give them a program of exercises that they can continue with at home or at the gym, as you probably are aware. And we also keep very current with what's going on in the medical research, rehabilitation research, to make sure that we are up to date to what is most current in the treatment of any condition that we see in this facility.
Boy, that's quite, you do quite a lot for everybody, and
we try.
Yes, I know you do. No, how long has Keystone been in this area?
We have been in McMurray since 1992. We started actually across the road, across 19 here in Waterden Plaza, from 92 until 1999. And then in September of 1999, we moved here to Waterden Commons Office Park because we needed a larger facility. And we wanted also to add a wellness center, a fitness center adjacent to the facility to serve the needs that we were observing at the time with the population, with the patients, and with the community.
I think I followed you from
yes, you did. Yes, you did.
Down over the hill all the way up to here. And I think that it is a very good idea for people to follow through, not just do their physical therapy on this side, but to follow through with all the other exercises. And like you've always told me, that exercise is the main thing to get better.
It is. It is probably one of the most important things to continue to be active, to be able to be active in your daily activities. Because again, I mean, we have 500 and some muscles in our body, several joints, and they're all designed to move, to be moved and to move. So if you want to keep active until your later years, you need to maintain flexibility, strength. And that's what we try to encourage and promote with our patients once they finish their treatment program, and also with the members in the wellness center. And actually many patients, many have been patients, choose to join then the wellness center to continue with their program in a supervised manner.
Let's see, what services does Keystone provide that benefit the community in the area? I think you almost answered some of that.
Sure. Again, we provide physical therapy services. We also have occupational therapy services. We have a therapeutic pool for patients that need aquatic therapy, aquatic exercises. And that pool is also open to the general public. They can get what's called a pool membership, and they can come and exercise in the pool up to 3 times a week.
Mm-hmm.
In addition to that, we offer educational services to the community. Over the years, we have had several lectures that are open to the community on topics such as arthritis, fibromyalgia, back pain, enhancement for golfers to have a better physique to be able to golf without injuring or developing back, neck pain, or any other pains. And we are now in the planning stages to develop 2 or 3 or more talks later in the year, and also some sports enhancement programs related to cycling and also to golf.
Yeah, well, it's so easy to do something wrong.
It is very easy to do something wrong if you are not properly supervised, especially when you are just beginning an activity, an exercise activity.
Mm-hmm. What hours is Keystone open?
We are open Monday through Friday from 8 a.m. until 8 p.m. So that allows us to give an open-wide schedule for people that need to come, and many people need to come after work hours because of their jobs. So we're opening the evenings to serve that segment of the population, and early morning for everybody. So 8 a.m. to 8 p.m. Monday to Friday can accommodate most anybody.
Mm-hmm. Okay, now if somebody needs physical therapy or is having a problem that they think they may benefit from physical therapy, what do they need to do?
Well, they can do 3 things. They can call us and make an appointment to be assessed, to be evaluated. Some people like to first talk to a physical therapist about their condition. So they can give us a call and ask to speak to one of us, and we will be glad to answer their questions. Or they can talk to their physician and tell them that they would like to come and see us for physical therapy.
Mm-hmm. How many therapists do you have here?
We have 4 therapists on staff, but they are highly trained in, again, the orthopedics and sports arena for physical therapy. We have also a highly qualified staff of physical therapist assistants and physical therapy technicians. So we have a very highly qualified staff, along with all the equipment that is necessary to be able to provide the appropriate treatment in terms of the machines, the electrical stimulation and ultrasound and so forth, as well as the exercise equipment.
Mm-hmm. There's something, the electrical stimulation, you don't feel anything when you're doing that.
Right, and again, sometimes you do, and it depends on what mode we are applying and for what condition or what symptom we are applying that. You may feel or you may not feel what that equipment is doing. Nothing that we do here in terms of any equipment is going to be painful for the matter. Okay, it's always usually pleasant. You may feel certain sensations there, but nothing that is painful.
Mm-hmm. So, what insurance companies do you participate with? Or
We participate with most insurance companies, and certainly Highmark Blue Cross, most out-of-state Blue Cross insurances. We participate with Aetna, Health America, Health Assurance, Workers' Compensation Insurance, Automobile Insurance, Medicare, all the Medicare HMOs we participate with. I think the only insurance that at this time we don't participate with is UPMC insurance. And not because we don't want to. We have been trying, obviously, for several years to try to be in their network. But they have their own chain of physical therapy facilities that are affiliated with them. So hopefully someday we'll be able to be in their network, because we get we get calls from patients several times a week that would like to come here, but they have, again, UPMC insurance. So at this time we cannot participate with that. But all the other insurances, pretty much, we do participate with.
Mm-hmm. There should be enough there to pick from. So, well, I have a little something of what's happened to me over the years. I know I came here a long time ago for different surgeries and all that, and you put me through quite a bit of physical therapy, and that. So,
Yeah.
of course, you know, I have to admit that sometimes I didn't listen too well, but you kept after me.
Well,
And,
we persevered.
Yes, you did, and it has helped me a great deal. And I know that I have been doing some things wrong and that, and I've learned to do things right. And so I really have you all to thank very much for keeping me going.
Well, you're very welcome. That's our job.
So I thought maybe now we might take a little tour of the facility here.
Sure, I'll be glad to show you what we have here.
Okay, we're back again now, and we're going to have Tony introduce the staff and show you some of the rooms and the different equipment here at the Wellness Center. Tony, it's your ball.
Well, thank you. Well, we have a few of our staff here, our highly qualified staff. We have Cindy Nicastro, who is a physical therapist assistant. We have Krista Farrell, who is also a physical therapist assistant. Jason Demchek, a physical therapist. Shelly Lovsensky, who is also a physical therapist. And Michelle Costella, who is a physical therapist assistant. And this is just part of our staff that is here on Tuesdays. There are other people, but not here at this time.
Now we'll be showing you some of the different rooms, and I'll give it back to Tony.
Okay, well, here we have a view of our physical therapy side, and as you can see along the wall, we have 8 patient treatment rooms. They're all private rooms to maintain the patient's privacy. All type of physical therapy equipment for different conditions, and then in this area we have our gym area where the patients do their exercises supervised by a physical therapist assistant or a trainer. And this is then our physical therapy side. You probably saw some of the rooms. And we're going to go now, I guess, to the Wellness Center area.
Okay, we're now over here in the Wellness Center, and I'll turn it back over to Tony, and he can continue from there.
Okay. This is our Center for Wellness, and I'm going to introduce Joe Scandale, who is one of our personal trainers, so he can give you a better description of what we do in the Wellness Center.
Thank you, Tony. Hi. What we would do if you come in for a consultation, we would set you up on a personalized program for your needs. And of course, since we're affiliated with Keystone Rehab, if you're a patient over there, of course, we can talk to Tony or one of the other therapists to see if there's anything you shouldn't be doing or something should be added in. So they're really people specific. We work with you with all the machines, get you oriented to them, and we're always here to help. We give you nutritional programs, and we're just here to help. And everyone should start working out, because now that there's a lot of literature out, I've been stressing for years, especially women, older women, postmenopausal women, should lift weights. Now it's recorded with documentation by doctors that aerobics isn't the ticket. They need to come in here and strengthen their muscles to prevent osteoporosis. So you should really think about that. And cardio is good too. You need it for the heart. But overall, you should exercise. Flexibility, any age you can increase flexibility. You do not lose flexibility as long as you don't have any arthritic changes in your body. I also offer, there's massage therapy here. Come down and see the facility because it's a diamond in the rough, and you'll be very pleased. How's that? Is that good? Okay.
And we can also here emphasize the fact that we have a full line of exercise equipment, a full line of aerobic equipment, including stationary bicycles, recumbent, upright bicycles. We have treadmills, we have elliptical trainers, upper body ergometers, step trainers. We have also free weights, and that's what Joe does also. He do personal training, emphasizing, again, free weights, strengthening. We also have classes, personal training classes, group classes. We also have a pool that we're going to go and probably show in just a couple of seconds here. But this is pretty much our Center for Wellness.
Okay. Jim, perhaps maybe you could tell the people the hours that we're here.
Sure.
And that.
The hours are Monday and Wednesday, 6 a.m. till 9 p.m., Tuesdays and Thursdays, 6 to 7 p.m., Friday, 6 to 5 p.m., and Saturdays, 7 to noon.
Okay, so that gives you plenty of time that you would come in, and someone will be here to help you. And there's always something to do here, and Joe keeps you busy, believe me. Okay, now we're into the pool area now, and this is the fun part. So I'll go back to Tony again and Joe, and they can tell you what's going on.
This is our exercise pool. Here we have certain hours for the patients to exercise, to have their therapeutic activities that require use of water therapy. But also we have the members of the Center for Wellness make use of the pool to do exercises. We have what is called just membership, pool memberships, where they can join just to exercise in the pool up to 3 times a week. We also have aquatics classes at certain times of the day, and is used for different types of aquatic exercises, again for strengthening, for endurance, for flexibility. People with arthritis, people with fibromyalgia benefit from it. People that cannot work with gravity, the buoyancy of the water allows them to move significantly better until they are ready to come out on land and exercise.
Okay, what's this right here, this contraption? What that's?
This is a chair lift. Okay, so we can somebody that cannot come down in the water through the steps on their own, then we put them in the chair, and there's a hydraulic lift that will bring the chair up, turn her around, and bring them down into the water, and the same thing to come out of the water.
Oh.
Okay, so they don't have to, they cannot walk, they cannot bear weight for whatever reason, post-surgery, then we can put them in the chair. Many times we have people that cannot even stand in the water, so we just put them in the chair, they get strapped, bring them down, and they can exercise while in the chair in the water.
Well, that's a wonderful convenience there. I mean, because there are some that need that help, and which isn't offered too often, and it's something I think that is very worthwhile. Don't you think so, Joe?
Oh, most definitely.
Mm-hmm. Okay, so I guess this completes our tour, and this is Erma Grego from Senior Perspective. Thank you.